I'm Dr. Rashita Shah, presenting you Spine Theory, a podcast in collaboration with QI Spine Clinic, India's first neck and back experts. Listeners, today we have Dr. Gautam Shetty with us. He's a Chief Medical Officer and a consulting orthopedic surgeon with QI Spine Clinic. Welcome, Doc.
Hi, Rishita.
Hi.
Thanks for having me.
Doc, why don't you tell us a little more about yourself?
Well, I'm a practicing orthopedic surgeon in the field for the last almost 18 years.
Wow.
And I have been in association with QI Spine Clinic for the last, since 2014 almost. So almost a decade. And I've been seeing a lot of patients, spine patients, all kind of orthopedic patients in my career. I also have a keen interest in research, so we published a lot of papers, and specifically with QI, we have published almost 16 papers in international journals.
16 papers in a decade, that's a big achievement, Doc.
Thank you.
Okay. So, Doc, in your daily interactions with the patients, do you think the patients have a better knowledge about their back, about what are the causes for their back pain? Are they more aware now?
I think they are aware to an extent, but because there's so much of information out there, they also tend to get confused very easily, and they tend to kind of overdiagnose themselves and have an extreme view of what they're suffering from. So I think although there is a lot of information out there, there's lack of clarity overall.
So they always seek the Google doctor before meeting you?
Absolutely.
And how does that work?
So we end up having to answer a lot of questions when they see us. But I think it is important to clarify all of these doubts which patients come to us with. And I think it kind of it helps us interact with the patient better and clarify most of their doubts because they already come prepared with the questions. So that way it's a positive.
That's it. So do you think that the incidence of back pain or back pain amongst people has increased recently because of the whole growing cafe culture? Do you find that you have more younger people coming with back pain now?
Yeah, if you look at the trends also in literature, studies done by the World Health Organization, we see that year on year there is an increasing trend when it comes to spine pain, whether it is back pain or neck pain. A lot of that is actually attributed to the overall sedentary lifestyle which a bulk of the world's population is following currently, where it involves either sitting for long duration for many years, specifically in a bad posture, or certain other health related issues which also is related to spine pain. So yes, we are seeing an overall increase in trend of neck pain and back pain. We are also seeing it in a lot of younger people in their 30s, and we also see that these people, although they get better initially, they keep coming back with repeated back pain, neck pain, repeated episodes of these.
So do you have one suggestion for the younger people, one thing that they must do to avoid back pain?
There's not what we don't have like as such one thing which is a solution for everything. It's a bit of everything. An important aspect is the way they work and live in their daily life. Like for example, if somebody is sitting and working as a desk job and has to sit, so taking care of posture, making sure that they take frequent breaks, this is a good starting point. And that can help prevent a lot of the discomfort and pain which people feel. And if they seek medical help on time, especially if they have repeated episodes, then that also helps prevent a lot of these episodes which can happen in the future, or they can get better early.
So is there any precautionary diagnostic tests that they could do to know if they are prone to having back pain anytime soon?
We can't actually, there's no diagnostic test which can actually predict whether somebody can get a back pain or a spine pain. But See, we need to first understand, before we get into that, we need to understand what is the cause of back pain or neck pain. Okay, we know from practice, from experience, and scientific literature that almost 80 to 85% of patients who have spine pain, back pain, neck pain, it's primarily because of two common things. One is bad posture, and second is weak muscles around the spine. Okay, now a lot of people do MRI, X-ray to diagnose the cause of their back pain, but remember that MRI and X-ray cannot detect weakness in the muscle.
Oh, okay.
So at QI Spine, we have been, we have been a pioneer in kind of focusing on that aspect of diagnosis, wherein we have something known as digital spine analysis, where we actually test the strength, the balance, and the range of a muscle around the spine. So we have machines where we actually test the patient, and we kind of test each group of muscles which support the spine and look at which muscle group is performing the least and therefore which needs to be targeted in treatment. So DSA, I feel, is a very important test which can detect the cause of back pain or neck pain early on, where the muscle weakness is the primary cause.
Okay, so where does the digital spine analysis be done? Do they need to go to a diagnostic center, or where can they go?
We right now QI Spine DSA is exclusively available only in QI Spine. In fact, in the entire Asia, QI Spine is the only clinic which actually does DSA. So if anybody wants to do a DSA test, they are free to do a consult at the clinic, at our clinic. We have around 22 clinics across India, and they can go into any of our clinics and then do that test, and the doctor there will actually explain the report to the patient and recommend certain rehabilitation programs if required.
So, Doc, when should one do a MRI or an X-ray?
MRI, X-ray is typically recommended if there is a serious cause, underlying cause, which is causing back and neck pain. When I say serious cause, I'm talking about conditions like fracture of the spine, infection of the spine, any kind of condition like tuberculosis of the spine, or if a patient is having back pain and leg pain for a long time, which is just not getting better with different kinds of treatment. So in there, we actually want to understand what is the specific cause of the back pain and the neck pain, because when somebody has a serious issue and the pain is just not getting better despite treatment, then that means the reason for the pain is not muscular anymore. It is probably something deeper inside which is going on, and for that we usually recommend an MRI or an X-ray.
So what I understand is that your digital spine analysis is your primary test and your MRI and X-ray are your secondary test?
Correct.
Okay, and
so primary test, yes, DSA is a primary test, but we also need to understand what could be the underlying diagnosis and the cause, and basis that we recommend tests. Now, like I said, 80 to 85% of our patients with back and neck pain, their primary problem is in the muscle. Okay, so there we can do a DSS test. That is a primary investigation or the test which is required in these patients. The remaining 15%, where there is a more serious underlying cause, there after a medical consultation, we recommend further tests if required, specifically MRI and an X-ray.
Okay. So, Doc, what are the most common conditions that you see in your everyday practice, especially in the young population?
Okay. So, like I said, a majority of patients who have neck pain, back pain, the bulk of it, not just in India, in our practice, but all over the world, the primary cause is postural, poor posture and weak muscles. But we also have a category of patients who get radiating pain down their legs or around their buttocks or down their arm with the neck pain, where the cause could be something related to the disc. Okay. Now you may want to know what exactly is a disc. Now, if you look at the spine, now I have a model here. Now, typically we have blocks of bone from top to bottom in our spine, and between two blocks of bone we have a cushion which is known as a disc. Okay. Now, for any reason, if this disc shifts behind, then that can irritate the nerve right behind the disc and cause pain down your arm or your leg. So the second common cause of back pain or leg with or without leg pain is if there is a problem with the disc.
So is this what we call, or people call it as a slip disc?
Yeah, that is exactly what a slip disc is. Basically, slip disc means that the disc which is supposed to be in place between the two blocks of bone has shifted out or slipped out of place, and therefore it is called slip disc.
So what is that one thing that you can do to prevent the slipping of the disc?
I think prevention, like I said, is we need to understand why exactly slip disc happens. So slip disc typically happens if one, you have weak muscles which are supporting your spine, and then you are working or sitting in a bad posture for many years. Now, when that happens, your muscles are no longer capable of bearing that load, and all the load goes inside into the disc and the bone. Now, after a while, after a certain limit, the disc will not be able to take that kind of load, and therefore you start seeing that the disc starts getting damaged, and then slowly with that damage, the disc can shift out of place.
So is there any medicine that one can take to prevent the damage to the disc, or is there any other better solution for it?
More than medicine, I think, Rishita, the best thing somebody can do is basically take care of their spine. Okay, take care of the spine in terms of, when they are working or living their daily life, make sure that they're maintaining optimum posture, whatever they're doing. And second is, with age, our muscles tend to grow weaker, and therefore some amount of exercise has to be done, specifically targeting the spine. So if we maintain good posture and do exercise to keep our muscles toned and strengthened, then yes, you can kind of prevent
Further damage to the
disc.
Okay, that's good to know. So Doc, we understood what slip disc is. What is sciatica?
So sciatica is actually a progression of slip disc. So like I said, what happens in slip disc is that the disc in between the bone shifts behind and starts irritating the nerve right behind the disc. Okay. Now, if there is a lot of pressure on the nerve, then that pain can go down somebody's leg or upper arm. Okay. And that radiating or pain which extends from the spine to the end of the limb is known as sciatica in common language.
Okay.
So sciatica is basically a progression in the severity of slip disc.
Okay. And how effective would be a pain-killing patch or the pain-relieving sprays? How effective would they be in treating a sciatica or a slip disc?
If you look at any kind of pain medication, whether it is a patch or any or an oral medication, or even these Medicaid oils people use, they do help, but temporarily, and they are primarily to basically suppress the pain. Okay. At QI Spine, we have something called a cell repair therapy, which is basically that we apply a very low dose electric current, which is in sync with the natural electric field of the body. And it not only helps reduce the pain, but it also reduces the swelling locally and helps repair tissue there. So that modality, in our opinion, actually not only reduces pain, but also addresses the root cause of the problem, which is basically local tissue damage and swelling. We have done a clinical study where we have shown, our data has shown that it works very well in bringing down pain and disability in patients with back pain and neck pain significantly.
And does it work effectively in the younger as well as the older population?
It works across all age group. No matter where, whether it is the neck or whether it is the lower back, whether it is a young patient or an old patient, we have found it quite effective in a majority of our patients.
So, and this advanced cell repair therapy that you're talking about, is it available everywhere in India, or is it exclusive to QI Spine Clinic?
This, just like the DSA, is also exclusively with QI Spine Clinic. So, if any of our patient is undergoing treatment at our clinic, then we do apply this to most of our patients to reduce pain, inflammation, and to enhance tissue repair. So yes, it is exclusively with QI Spine Clinic.
Okay. So Doc, going back to the Google Doc, those doctors are also treating. So there are lots of online exercise videos, how to take care of your back, how to take care of your neck, available all over the social media. Do you think they're effective enough for self-treatment? Is self-treatment the future?
I think self-treatment, yes, it can be effective provided it is done under the supervision of a medical expert. Okay. A lot of times what people do is that they have back pain, neck pain, they search for some video of some exercise. Somebody would have told them ki you do spine ka exercise and you'll get better. So people search for those exercises and start following those videos. A lot of time these can actually be counterproductive because the response to treatment or response to exercise depends on what is the underlying cause of the problem. Okay, so there it is possible that certain exercises may not be good for you and might actually aggravate your pain. So therefore it is advisable that any kind of exercise you're doing should be and only should be done after consulting a medical expert and doing it under their supervision.
Okay. And how is QI Spine Clinic different? Or let me reframe my question, that if I had a slip disc and I came to QI Spine Clinic, what would my treatment journey look like?
So QI Spine, see, we put a lot of emphasis on diagnosing the cause of the underlying problem. Okay, so if somebody has got neck pain, back pain, sciatica, first we want to understand where this pain is actually coming from. What is the diagnosis? Okay, so we have actually all our doctors, all our physios in our system, rehabilitation experts have been trained extensively in diagnosis. We also have an algorithm which is on an app, which actually is a very, very useful tool and helps the doctor diagnose the patient accurately and consistently. Okay, so the whole idea of giving that app in the hands of the doctor is basically to minimize error. So what the doctor does is that the doctor takes a very extensive history of the patient, does a thorough examination. If the patient has already done an MRI, X-ray or any kind of investigation, all of this information is inputted in the app, and the app kind of confirms what the doctor thinks is the underlying diagnosis.
Wow.
So the first stage is of course the diagnosis. The second stage is that if the patient is in a lot of pain, the second stage is basically to reduce the pain and reduce the inflammation, whether it is at the back or the neck. Like I said, we use cell repair therapy extensively, which helps a lot of our patients. In a small percentage of patients where it is not working, we take the help of our consultant orthopedic surgeons who check the patient again and prescribe medications if required. Okay. The third stage is basically that once the pain is better, we start them on exercise, different types of exercises, which basically helps in spine rehabilitation. It helps in strengthening the spine, it helps in reducing the pressure on the disc if there is slip disc, and then helps restore normal function of that patient. So broadly, these are the three stages of the treatment in our patients. First, diagnosis, second, pain management, third is rehabilitation with exercises.
So what I understand from what you're saying is from diagnosis to advanced therapy that QI Spine Clinic has, and also a panel of doctors that you have. Does it make that QI Spine Clinic is a one-stop solution for any of your spine needs?
Absolutely. So our approach at QI Spine is that we don't treat the spine, we treat the patient. We don't treat the MRI, we treat the patient. Okay. So we look at all aspects in the patient of what is actually holding the patient back from recovery. Okay. So therefore we follow a multidisciplinary, multimodal approach to treating the patient, where we have experts in rehabilitation, we have orthopedic surgeons, we have rheumatologists, we have neurologists, we have physicians, we even have a psychologist on board and a dietitian who basically gives their input or their opinion wherever it is required for a particular patient. Okay. So it's not just about treating only the spine, it is about treating the patient, because we know from experience and from science that back pain, there can be different contributors to back pain or spine pain. Okay, if somebody is deficient in something, then that can add to the pain. Okay, if somebody has an underlying rheumatoid or rheumatological condition, then that can add to the pain, and therefore all these things, all these aspects need to be addressed very, very clearly early during the treatment. So that is the principle, and that is our concept of treating a patient: multimodal, multidisciplinary treatment of the patient.
one more thing. When you said you have a psychologist on board, does that mean that people having back pain, it affects their mental health as well?
Yes, I think it. See, any person living with chronic pain, where especially if none of the treatment is actually working for him or her, that can be very very draining, and that can be very disheartening for the patient. Okay, so we've seen that patients with chronic pain do tend to have anxiety, they have depressive symptoms, they have low energy, they have negative thoughts. Now, when you treat such a kind of patients, we have to make sure that those thoughts and those beliefs are also addressed. So therefore, we use a psychologist to kind of counsel the patient in terms of the overall outlook and how the condition can change positively with rehabilitation, and that helps us take care of a lot of these negative thinking, negative thoughts which the patient might have from his past experience.
So you indeed give a holistic treatment approach to them.
Absolutely.
So lastly, Doc, what is your one take-home message for all our listeners out there?
My one take-home message would be that people need to remember that the spine is a central pillar of our body. Okay, so the spine is in action no matter what we are doing. So my suggestion to people is that please do not neglect your spine pain, especially if it is coming back again and again. Okay, it's very important that if you are having persistent back pain or back pain or neck pain which is coming again repeatedly every year, then it is very important that they need to seek advice from medical experts who are experts in dealing with such kind of situations. Okay, that will help you correct the course, correct the situation very quickly, and prevent further such episodes happening again and again, and pain actually causing disability and not letting you live your life normally.
So listeners, as you heard it from the doc, that do not ignore your small or big pain. And in any kind of pain that you have regarding your spine, QI Spine Clinic is your one-stop solution for same. Thank you, Doc, for your invaluable insights on the spine. And thank you, listeners, for joining us on the spine theory. Until next time, stay strong, live long.